joins us now. Dr. Whelan, good afternoon to you. I really do appreciate the time. There are a lot of numbers here. Let's put transmission to one side for a moment. We want the vaccine to protect us from severe illness. What's your research found with regard to the Omicron variant and the Pfizer vaccine?
Well, good afternoon to you, Stephen, and good afternoon to your viewers. Thank you for hosting us. Yes, indeed, I think our vaccines are primarily designed to reduce severe disease and death. And what we're seeing out of the data from our discovery analysis in collaboration with the South African Medical Research Council is that the vaccines have retained their effectiveness in reducing the incidence of severe disease and death. So what we're seeing in the data is a 70% reduction in relative risk in vaccinated populations versus unvaccinated populations against severe disease, where we use hospital admission as a proxy. So effectively what that means is if you do inadvertently get infected with COVID, the vaccines will reduce your risk by 70% of a hospital admission.
And is there a difference depending on how old you are? And there are two factors here. One is the older you are, the more likely you are to get severe symptoms. Also, the older you are in South Africa, the likelihood or the earlier you actually got your vaccine dose, which means that it might have worn off a bit.
Yeah, it's an excellent question, Stephen, and a very important question. So what we're seeing is in people over the age of 70, the effectiveness drops to about 60%. In reducing the incidence of hospital admissions, so as compared to the general population at 70%. On the converse, what we're seeing is between the ages of 40 and 50, we're seeing 80% protection against your hospital admission, and we're seeing similar stats play out in 30 to 40-year-olds. So we are seeing slight differentials across the age curve. The over 60s, over 70s is an interesting observation for us, and that may mean that we're seeing slight waning vaccine effectiveness as well. You'll recall that over 60s have been vaccinated since the 17th of May already, so we may be seeing that effect playing out in our data at the moment. But even 60% protection is excellent protection against severe disease and hospital admission.
Well, I was going to come to that because a lot of people would have remembered during Delta, for example, it was 93%. Everyone was very excited. 60% is a lot lower than that, and yes, it is a very important measure of protection. The chances are still in your favor.
It's an extremely important measure of protection. When one considers the flu vaccine in any given season provides somewhere between 40 and 70% protection, the COVID vaccine is standing up very well under the circumstances. You must remember that the Omicron Variance has got very, very significant mutations. And the fact that the vaccine is held up against a severely mutated variant is, I think, bodes very well for us. And yeah, we certainly are very happy with these findings. And we'll move forward into a boosted dose terrain now, and the boosted doses will likely increase that protection further. So yeah, we're in a reasonably good space at the moment. With boosted doses to come, there will be additional protection to come as well.
And the number of people you have access to here, if I've understood this correctly, it's basically your members. You know that they've been vaccinated because you pay for it. You also know when they go for a Covid-19 test. You know when they go to hospital because you pay for it. So that's where you get the data from. 211,000 people. Is that enough to be definitive?
This is a very, very big study, and certainly the largest study to date. The previous study that we saw come out over the weekend had a sample size of 581 people. This study, as you rightly mentioned, includes 211,000 people. And when one considers the initial studies that happened in preparation of the vaccines, those studies ran to about 40 to 60,000 people in their sample. So we got a study that's about 3 or 4 times the size of the original study sample. So we're very confident in this data set. And then, as you rightly mentioned, what we're able to see from our data is people who either vaccinated or unvaccinated. We're able to see positive test results. We're able to see hospital admissions and indeed ICU and high care admissions from the data. We do the analysis in an anonymized manner where we compare vaccinated populations versus unvaccinated populations. So it's a very robust analysis, and certainly the largest analysis globally on Omicron to date.
I'm sure there's a huge amount of research going on this. When Omicron was discovered, we were told 2 to 3 weeks we would know what the vaccines are actually doing against Omicron, and so it has been. There'll be other studies in other countries. Some of them will be private companies like yours. Some of them will be other governments. Have you been able to compare any of your data yet with theirs?
Well, I think the studies are certainly going to start emerging. You would have seen today that both the UK and Denmark are seeing big Omicron outbreaks, and our scientists are certainly collaborating with the UK scientists and European scientists. In fact, we have a collaboration with Australian scientists and US scientists, and we've shared our data and results with them. And we expect that they will begin to share their data as that emerges over the coming weeks or so. Insofar as South Africa, it's been a sterling public-private partnership in the COVID response related to both the initial phases of COVID as well as the vaccine program. And as I said, we've collaborated with the South African Medical Research Council together with the National Department of Health on this analysis. So this is very much a South Africa analysis rather than a discovery specific analysis. And we're very proud to a part of this and contribute to this body of global evidence.
Dr. Whelan, it's a very complicated question that I don't understand all of myself, but let me try and get it in proper English. We know that many people have been vaccinated. We know that gives protection, and from what you're telling us and from the other evidence that we see, it's clearly doing its work. We also know there seems to be we also know that most people in the country now, in some cases around Swane, 70 to 75% of people have been exposed to the virus in some way, shape or form. Those are from seroprevalence surveys. So people have some sort of immunity from the virus. We also know from what the doctors are telling us in various places around the country that it seems that during this wave we are not having as many people with severe symptoms. This morning, I think it was 405 people in ICU units at the moment. I think 178 on ventilators in previous stages during previous waves. Those numbers for ICUs and for people on ventilators was much higher. Is it possible to say at this stage that the reason we are having fewer people presenting with severe symptoms of COVID-19 is because of the vaccines doing their work, or because Omicron is not as severe, or is it a mixture of both?
Yeah, it's a very important question, Stephen, and we certainly have a complex environment at the moment. There really are three factors at play, and you've alluded to some of them in your prelude here. I think the first one is that South Africa has had a severe COVID-19 outbreak, so we do have a large portion of the population has already been infected by COVID. Estimates are around 70%. You would have seen Discovery data on that over the last few months as well. The second component is that the vaccines and the vaccine program has led to vaccine-generated immunity across our population. And in many respects, we've now delivered 27 million vaccinations. We've got just short of 36% of adults fully vaccinated. And that's certainly contributing to immunity. I think the third important component to note on this, Stephen, is that relatively speaking, we have a higher portion of our over 60 population being vaccinated compared to younger population. So about 65% of people in South Africa over the age of 60 are now vaccinated, which is very, very good. Where you compare that to people under the age of 60, about 35% vaccinated. So what we've done is we've swung the tables of risk. You'll know that COVID disproportionately impacts older populations, and because we have high proportion of older populations now vaccinated, we've begun to swing that equation, and that may well be resulting in lower admission rates, and that we're focused on that high-risk population, got them vaccinated, built up their immunity, and therefore they've been able to navigate the Omicron breakout more effectively.
Dr. Ron Whelan, I really appreciate the time. Thank you. Head of Discovery Health's COVID-19 Task Team.